Hepatitis B is a virus which can infect people and cause damage to the liver, more specifically to liver cells, where it can incite or precipitate or trigger an immune reaction and cause inflammation. With long-term infection or inflammation, it can cause scarring or advanced scarring in the liver, like cirrhosis, but also the virus can incorporate into the genetic code of liver cells and thereby posing a risk or increased risk of liver cancer down the track. Hepatitis B is acquired either through the exchange of blood or bodily fluids. It can occur from an infected mother passing on to the baby during childbirth, but also through unsafe or unprotected sex. The use of unhygienic or unsterile injecting equipment or needles can do that, in tattoos, for example, or body piercing, and very unusually with accidental exposure such as needle stick injury. The best way to prevent hepatitis B is through immunization, vaccination. It is very effective, so 95% of people who are vaccinated will develop immunity to hepatitis B. We recommend that children, so newborns, infants, young children, adolescents, and adults who are at risk of acquiring hepatitis B have vaccination to prevent acquisition of hepatitis B. Some people may not know they have hepatitis B or have acquired hepatitis B. In children, for example, they may not have any realization they are affected by the virus, and it's decades later that they may manifest problems or complication or consequences of long-term infection with hepatitis B. In adults who acquire hepatitis B, 1 in 2, 50% may develop symptoms, and that can include fatigue, so feeling really tired, you've got a viral illness, and others may develop jaundice, so they get yellowing of their skin, or the yellowing of their whites of their eyes, or they pass very dark urine. But the other 50% may have absolutely no symptoms, and we call that a subclinical infection. There's an wealth of treatments available now in hepatitis B. They're highly effective. They're also very simple to take. The majority of them consist of just taking a tablet once a day, and very well tolerated, so very minimal to little side effects. It's important that people discuss these options if they need treatment for hepatitis B, because there's a whole array of them, and we can actually tailor or individualize those treatments to the person, and that may be in the context of their age, or if they're a man or a woman of childbearing age, so they're planning to have children, or if they're older and they have underlying more severe liver disease. Absolutely. So people who have long-term infection with hepatitis B may be at risk of advanced scarring, so persistent inflammation, damage to the liver, scarring to the liver, and could be at risk of developing liver failure. They're also very high risk of developing liver cancer. So if they fall into those high-risk groups, and particularly if you're African over the age of 20, if you're of Asian extraction over the age of 40, or if there's a family history of liver cancer, you must see a doctor, because it could be important that we do some screening tests to try and pick up this liver cancer early, so we can do something that's curative about it or prevent it. Well, the issues may not necessarily pertain to the liver only. For example, if someone with hepatitis B not requiring current treatment but may require profound immune suppression in the future, for example, in the situation of cancer chemotherapy, or requiring immune suppression in the context of inflammatory disease such as inflammatory bowel disease or rheumatoid arthritis to try and control activity of the disease, someone with hepatitis B could be at very high risk of decompensation or a flare of their hepatitis B, causing liver failure, or even not surviving the consequences of a flare. But that person can do something about it in preventing that flare by seeking advice from their liver specialist and starting antiviral treatment before the immunosuppression. So if they're hepatitis B positive or have hepatitis B and about to face immune suppression for whatever context, such as cancer chemotherapy, they must talk to their liver specialist about what we call prophylactic antiviral therapy to prevent these dangerous flares. It's absolutely critical to have that conversation, frank and open conversations with friends and families, because the more you talk about it, the more likely you're going to learn and understand about this virus, its effects on the liver, and its long-term consequences on the liver. So scarring in the liver, cirrhosis, and the risks that you might be predisposed to, so liver cancer, for example. Also, as I've said, there's a wealth of treatment options out there, and so if you talk about it, you're informed. My key message to people living with hepatitis B is be positive, be informed, and start that conversation with your doctor and your liver specialist so that you understand what this virus does and that you are more likely to be able to look after yourself and your liver better.